Holford Health Centre, Sally speaking.
What would happen if those feelings got worse? What would you do?
Before, especially first year of uni, I drank a lot. For like 3 bottles of wine within the space of 10 minutes.
Have you had sex yet?
If he wants to have sex 6 weeks after giving birth.
Now, I'm going to need you to lie on your side. So next thing you feel will be a slight prick as we put the needle in, OK?
Have you got any illnesses that we should know about that you've had before? Are you on any medications?
I was shot a lot of times.
I'm unhappy to mention it is affecting my sex life.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
Oh, goodness me.
At the moment, we're working on a morning surgery, so if it's urgent for today, it is going to be end of surgery at 11:30.
Sarah, jeans, please.
I've got this
All right.
on my leg.
Yeah.
Now, this is the 3rd or 4th time it's come up. I've had steroid cream. I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it
Or
did
does
do.
it not?
Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on
Yeah.
it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK.
No.
Just returning that key.
Wonderful. If I could ask you to put that straight on one of the top first 4 hooks, that would be very gratefully received. Thank you very much indeed. Pleasure doing business with you.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here.
Yes.
Yes, you've moved from a local practice?
Northvale.
Yeah. So what do you think are your main medical issues at the moment?
I breathe.
Yeah, sounds like it, doesn't it?
Struggling the last few days.
Right. So you've got COPD.
Yeah.
Yep. And any other... You've got diabetes.
Well, they think I have, but they think it might be to do with because I'm on so many steroids.
Right. OK, well, we'll talk about that in a minute. And then... So you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah.
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike.
Right,
and he's actually going to do a check of your heart disease, your diabetes and your COPD.
Or shall I bring Pat lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. And that's why you need a bit of help with your fluid, okay? So I'm your doctor, and we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
Okay, then, thank you.
Good. Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. Okay, bye now.
Thank you.
Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
Okay.
And of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? Well, they cause skin infections really commonly. They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done. All right, nice to see you. Yeah, no problem. Nice to see you. Bye.
Bye.
Okay, that's fine if you'd like to go to the upstairs waiting room.
Okay, no problem.
Thank you. Hello, can I help?
Mr. Apatrasoe.
Yep.
I'm Dr. Lee. Come on down.
Expect to be from China.
Yes.
Or Jet Li or Bruce Lee.
Yes, come and have a seat. People often expect a Chinese doctor with me.
Doesn't matter.
No, have a seat here anyway. I think you're a visitor. Are you visiting us? Or are you a patient here?
For the moment, I need to subscribe, you know, because I need the doctor.
You're up in Brown, and that means you're what we call a temporary resident, I think. But you're living here, are you? Are you going to register permanently here?
I have, yeah.
Where have you come from?
My father from Belarus, my mother from Greece, from Athena. And I'm Danish resident. After the high school, I was a security officer from army. SWAT, you know, the special squad, you know, paratroops and other things.
Have you got any illnesses that we should know about that you've had before? Are you on any medication?
I was shot a lot of times.
What's brought you here today?
Throat, headache. That's the only reason why I called up, is because I had this sort of quite a bad headache this morning.
And how long has he been complaining of headaches for?
Since he started a nasal spray.
And it's all the way from here?
From here.
Down to?
Here.
Down to the back there?
Yeah. Sometimes it's right on the center.
It's in the middle, yeah.
Inside, really, you feel sort of heat.
I was shot a lot of times.
Do you want to tell me a bit about it?
I was cut here. This is from 1986. This is from 92. I have another one here. I was shot here. And 48 part of metal was here.
Oh, yeah.
And take it out. But I'm perfect. No problem with this.
Okay.
The only thing what put me down, it's sinus. I have pain with sinus. Yeah. No. I don't feel good.
No. And you're not taking any tablets or medicine?
Today I don't take it nothing.
No, right. So is it here? Just right there?
Yep.
And then if I just take those off. So here's your other sinus. That's your frontal sinus there. And
I know it's facial sinus.
Yeah.
I know about this. This you have a lot of sinus.
Yeah, and
but
these
here it's about this one.
And these ones
Not
are all
this.
right, are they?
Yeah. Malar sinus, it's okay.
Okay. Is there anything coming down your nose from up here?
Yeah, was yesterday some like yellow things, and in the morning blood.
Okay. A bloody discharge is very characteristic.
It's good if you
I'm just going to do your blood
go out.
Yeah, but it does make it very likely that your sinus is infected, so you have diagnosed yourself correctly, I'm sure. Okay. Relax a little and I'll just see what this is going to be up to. It's 184 over 104.
because of pain.
Do you think? OK.
I'm pretty sure about this. Because normally I have 137.
But I'll print you out an antibiotic to take for this. Are you allergic to any antibiotics?
No. I'm allergic for the stupidity. The only thing.
Take this, 2 today,
Yeah.
and then 1 every day till you've used them up for a week. And that should settle it down. You must now book an appointment
yeah.
for maybe 2 or 3 weeks' time to come and have your blood pressure checked again.
Okay.
And I hope you're better soon. Yeah.
Thank you very much.
Thank you. I hope
welcome.
To see you in 3 weeks.
Come on in. Have a seat.
Thank you. Yeah, I was in hospital all of last week.
Oh dear.
Because of the DVT thing. It bled everywhere.
Bled?
Yeah, it was. I think it was a varicose vein on the
Okay.
surface of that.
Yeah.
I was washing up and it just bled everywhere.
So it was the bleeding that kept you in hospital?
It was the bleeding that kept me in hospital and the swelling of my leg, and they said that the DVTs got bigger.
Have you got an appointment with the haematology doctors, the blood doctors?
Yeah, I'm getting one. I'm literally waiting to hear.
Is there anything to see, or is it all covered up with
It's
the
all
big
covered
dressing?
up.
I'm not, let me not look now, because actually, as long as it's OK from your point of view,
it's
the
all
nurses
right.
are going to look this afternoon. So if there's anything if I take the dressing down and it causes loads of bleeding, then we'll have to get the nurses involved.
Also, as well, I haven't been on them for a while, but I was on citalopram. I feel kind of OK, but I'm kind of waiting to go down.
And was it depression that you suffered with before, or did you get much anxiety with it as well?
Yeah, the anxiety's kind of gone.
And when people get depressed sometimes, they get, other thoughts or other...
Yeah, I have been there.
More serious kinds of thoughts.
Yeah.
Has that drifted in, do you think?
Yeah, a little bit.
Hello, can I help, sir? All right, can I help?
That's exactly why I'm here, hearing problem. You go on,
I know, absolutely.
Catherine Amesbury, please.
Oh, that's me. OK.
Hi. Come and have a seat.
Nice to meet you.
Right, OK, so we spoke on the phone beginning of June, didn't we, about your X-ray? Yeah. Yes, OK. And how is your back?
Bad.
Right.
I've got a trapped nerve now. It's just constant pain. So
OK.
I don't know. What did the X-ray show?
Well, it shows some wear and tear, but it also shows reduction of the disc height on a couple of levels, so it makes me a little concerned. Is there any thinning of the bones?
Well, I've got sciatica at the moment all the way down this leg, and my leg's actually not working properly.
Right, OK.
It's really strange. It's like it doesn't belong to me.
OK, can we have a little look?
Yeah.
Put yourself up on the bed. OK. And if you bend this, so try and pull your heel into your bottom. OK, and push it up to the ceiling. Good, OK. Against again. That's it, right?
That's the weak one. Can you see where it's wobbling?
I'll just check your reflexes. Yep. Good. Fantastic. OK, you can jump up for me. OK.
I had a riding injury in my very early 20s, and I displaced 2 vertebrae, and it never was quite the same after that.
Sure.
But regular osteopathy. I mean, I can go for 2 or 3 years without seeing her, and then I'll tweak it, and she'll get it right. But this time, I haven't known to get it right. So, yeah, I'm just frustrated because I can't live my life the way I normally live it.
Yeah.
My maternal grandmother had osteoporosis. She was bent double in her 70s. But I have been on prescriptive calcium, vitamin D since my 40s because there was a risk.
So this graph shows us the green is essentially you don't need to do anything, OK? The yellow is we need to measure your bone density via a DEXA scan, and red, we need to just treat. Now, you are very much on the border.
I'd like to know then if I can.
Yeah, I agree. In terms of your pain and management at the moment, are you happy with what you're doing?
Yeah, I don't want any.
No. So we'll wait and see what DEXA shows. If you want some physio, just let me know.
Thank
All
you.
right, no problem.
Lovely
Nice to meet you. Yeah, you
Thank
too.
you ever so much.
OK.
Let me just check. You haven't had any more suicidal...
Not since being at home.
...plans or hopes to die or anything getting so serious that it's got that bad? No.
not since coming out of hospital.
What would happen if those feelings got worse? What would you do?
Normally, I lock myself away for 24 hours. In the past, what I've done, completely just lock myself away, don't do anything, don't allow myself to eat, don't allow myself to go to the toilet, nothing. And then I normally come out of it. Before, especially first year of uni, I drank a lot.
That's a common reaction or way of dealing with it.
And a lot quickly. So like 3 bottles of wine within the space of 10 minutes, like a lot.
Gosh, that is a lot. Mental health problems are really common, and young men suffering with depression is one of the things that we see very commonly in the surgery. William has suffered with on-off recurrent depression over the years, for which we've been supporting him. The natural feelings that you have when people first tell you about something really deep and personal is to empathise and do your best to be compassionate with them. And then the next stage is to try and move on and come up with some solutions to help them move forward with that problem. So it sounds, I mean, this is obviously complicated, isn't it? What about any counselling? Are you having anything at the moment? I'm just going to look at see if I've got any past history here.
Because I know I was on 10 milligrams and they increased it to 20.
How long have you been on it for?
Oh, God. It was when I was in sixth form, so when I was 17.
Yeah. So you've been on and off it for your mood for 6, 8 years?
Yeah.
It does take between 2 and 6 weeks to have its full effect.
Yeah.
And starting off slow and building up is a sensible thing, because then there's less to come off later. Okay. Do you want me to organise some counselling for you or give you the details about that? Because that's one of the other mainstays of treatment.
Yeah, that'd be cool.
And as I say, if anything changes or gets worse in the meantime, just let us know more urgently, obviously.
Oh, I do. Awesome. Thank you very much.
All right, nice to see you. Bye, then.
Bye-bye.
Hello, reception.
Hello, I need to make 3 appointments.
Hello, come on in.
Suffering terrible with migraines. Been suffering for about 6 years. I did get a preventative topiramate.
Okay.
It worked, but it stopped working now, so I've just given up taking it. I just thought it's best to come in and see you.
Yeah, have a chat about it. How often are you getting them at the moment?
I can get 5 a week sometimes.
Describe them for me, just
So I go funny in the eyes, and the head feels like and it's all pain in the neck as well. Just like a pressure building up, and then you feel like you're sort of slurry talking and things. So it's just strange how they just come on all of a sudden. The Migraine tablets are really great when you get an attack, but they do make you feel a bit... But they're brilliant for when they are needed.
So they're quite effective.
Yeah, amazing.
Yeah.
I just wondered if there was any other type.
Yeah. The answer to your question is yes, there are other things we can try. There are actually quite a few different preventative treatments for migraines.
Okay.
So we often try beta blockers, which were originally designed as blood pressure medication.
Okay.
But we use them for migraine treatment. They very occasionally drop people's blood pressure a little bit, and that can make you feel a little bit dizzy the first time you take it, while your body's adjusting to it. So we'd often try one that's twice a day.
Oh, twice a day.
Initially, I'll give you a month's worth as a kind of trial.
Okay.
If you find that it's not really the answer, give me a ring or come and see me again.
Yeah, it's easier to find sometimes, isn't it? Thank you very much for your help.
Great to meet you.
Nice to meet you as well.
Hello, can I help?
Hi there, it's Dan from Speechwrite. I've got an 11 o'clock with Guy.
With?
Guy.
Glyn.
Glyn, is it? Oh, they put Guy. Sorry, Glyn.
Leave me. The scarf, though.
Just get a phone, come back in.
I'll probably be still sat here.
Probably.
Okay.
If you're not.
Sean Priest, please.
Oh, here we go. That's me. Hey, brilliant. Hey, can you guess what it is yet? Oh, yeah, definitely, yeah.
Right, I'm Lizzie.
Hi.
What's been happening?
So, Tuesday of last week, I had a motorbike accident, collision with another vehicle. Fortunately,
car?
yeah. Well, Volvo, so you know, might as well have been a tank. Yeah. So I was thrown clear of it and landed on the verge, but I took all the impact on my hip. I managed to sort of bounce off the side of it and do a bit of a Superman impression.
Through the air?
Into the verge on the other side of the road. Basically, I can't sleep. That's one of the main issues because of the pain. Also, I've got some concerns. The blood from the bruise is beginning to spread. It spread around my sort of lower back, down my leg. It spread across my groin and into other areas.
Right.
Yeah.
Okay.
Yeah, so that's kind of a bit interesting there. So.
Okay, can we have a look?
Yeah.
All right.
Sure.
See how bad it is.
Yeah, no problems. I'm unhappy to mention it is affecting my sex life, as if having a smashed up hip alone wouldn't.
So what the bruising is?
Yeah, it's actually spread across into my genitals, basically.
So, oh, goodness me.
How are you, Michael?
Struggling, very difficult.
I understand you had a fall a few weeks back, was it?
Tuesday. I'm always falling over my hips.
I don't remember bumping it. And I span, and I fell on my right side.
As I've like jumped and sort of came down and landed on my leg, it's gone backwards quite a lot.
I tripped and then I landed sideways on.
Sleeping is just, you know, forget about it.
When you say it's affecting your sex life...
It spread into my testicles and pretty much halfway up.
Meaning that it's painful or you can't get an erection? Or...
No, I'm functional, but it's tender, very tender, yeah. So, yeah, if I could figure out how to manage that, that would be nice. Or just an idea of how long this is going to go on for.
Right, so, OK, pull your pants up.
Yep.
Come and have a seat again. So, the amount of bruising that you've got...
Yeah.
I'm not surprised at. I wouldn't be overly concerned about it. Given the mechanism of injury, to have come away that lightly, it's probably only down to the fact that you're quite muscly and you've got muscle to protect all of your bones and everything.
And muscle that bruises easily.
Yeah. You've obviously caused so much damage underneath your skin on the hip here.
Yeah.
It's filled to a capacity and then it's not really had anywhere else to go, so it has spread round the other sides a little bit. Yeah. Have you noticed it carrying on, spreading further? Or
It's reached the back of my leg just today. It was about here before, but this morning it's all down there. It seems every time I wake up, you know, it's in new and exciting areas.
If at any point your it looks like your circulation is changing at all, you know, if this lower leg starts going a bit of a funny colour, if you start to lose some of the sensation or anything like that, need to see you straight away and probably send you up to the hospital. In terms of what you can do to try and reduce it, the only thing that you can really try is just to ice it.
Is there anything I can do for the sort of pain management side of it and sleep?
Paracetamol, 2 tablets, 3 times a day during the day, and then your 2 cocodamol at night.
Okay. Are there any kind of like maybe almost like home remedies I can use to sort of try and disperse some of this blood, or?
Just gentle. You could try a gentle massage.
I'm talking about one specific area.
Not like deep tissue. Oh right, okay.
Yeah. It's not pleasant, and there
really isn't very much that you can do.
Okay, I'm happy to try deep tissue massage on the area. But,
I was thinking of your leg.
Brilliant.
I would just give it a rest if I was you. Yeah. Just give the whole area, just give it a rest.
Right, okay.
If it's hurting, it's trying to tell you, you know, give it up. Just stop for a bit.
Okay. Put it on the back burner.
Yeah.
Brilliant.
Abigail Lee. You can walk like that.
I can walk and feed.
Well, I'm Dr. Lee, so that's very good.
Yeah.
We share a name.
Appropriate, isn't it?
Hooray. So, is this a girl or a boy?
A boy.
Oh, very nice. And is it your first or not? How? So today, starting with you, how was it?
What, the birth?
Yes.
It went as well as such a thing does.
Yes.
Basically.
It's quite an experience, isn't it?
Yeah, and we had a home water birth. And that went really, really well.
Ooh,
I mean,
did you?
Yeah.
For a first baby, that's very good.
Yeah, it went. Yeah, it was. Well, you know, I won't say it was good exactly, but it went well. I didn't use anything, and yeah.
Well, it's very unusual to actually manage your first at home.
Yeah.
Did you tear or have stitches?
I did tear and I did have stitches. Yeah, I had a 2nd-degree tear.
How is it? Has that healed up quite well or not?
Yeah, I think so. I mean, I don't feel anything anymore, I guess. I'm not sure when it sort of... Oh, thanks for that. I'm not sure when it stopped hurting, really. It did hurt for a lot longer than I expected it to, I have to say.
So would you like me to have a look, or
I think
if
I'm
it
all right,
feels
to be
fine
honest.
to you, it's never quite the same as
Yeah.
it used to be. But as long as it's not too tight, really, that's the thing. Occasionally people get sewn up and they're just a bit wonky or tight, and that often settles down. And
That's all right.
sex, have you had sex yet?
Who wants to have sex 6 weeks after giving birth?
Hello, morning. Come on through.
Hand over your mouth when you're coughing.
Come on in. Come
Hello.
Take a seat. Hello.
You all right?
Yes, not too bad, thank you. So, Riley, you're nearly 11.
Yeah.
You've got this terrible cough.
Yeah, it's been about 3 weeks. Basically said it's starting to hurt his chest a lot, but I don't know whether it's just because he's coughing so much, but it's getting deeper and deeper, so...
So it's been there for 3 weeks already, and it sounds like this day and night?
Yeah, it gets worse at night, definitely. It's constant.
OK. Any temperatures or anything like that?
A bit hot now and again, but nothing major. It's just...
And are you bringing up some rubbish when you cough?
Yeah.
Mm. Do you want to put your top things off for me? And is Riley up to date with all vaccines for his age? Looks like he is.
Yeah, he doesn't really go to doctors very often, as you can see. He's very limited.
Yeah.
It's probably been about 10 times in his life.
Let's have a look in your throat. Open wide for me.
Turn out. Ooh,
Okay.
where are you going, Bubs? It's okay. Who's that? Peppa
Let's have a listen to your chest. If you come up here for me. Yes, please. Pop your T-shirt off. Excuse me.
Where's he going?
Come and take a seat there, OK?
There.
Yes, that's fine. Deep breath through the open mouth. OK.
Where are they going?
That's fine. I'm just going to have a feel if there's any glands around, OK? That's fine. You can pop your things on. Come and take a seat.
How are we sounding then, Doc?
Well, I mean, the chest actually doesn't sound too bad.
Okay.
So the cough sounds worse than the findings. So there's no temperature. You know, everything else is sounding okay. I'm a little bit suspicious of whooping cough. Pertussis is the other name. You know, it's just tends to go on for a bit, and it's sort of once you start coughing, you go on and on and on and on, and then stop, and then it keeps going on like this day and night. So I'm wondering whether we should do a swab, actually, for looking for pertussis. Whooping cough is a very severe spasmodic cough, by which I mean you get bouts of severe coughing, and according to the textbooks, a characteristic whoop sound at the end. However, in real life, you don't always get that. It usually goes on for 2-3 weeks, and patients present very tired with their symptoms, often not sleeping due to their symptoms. If you wanted to look it up, you can on patient.co.uk. So
No problem.
Website. OK.
Quick nose swab out there, is it?
That's just... If you take a seat in the waiting room,
Yeah.
and we'll get that organised straight off. There's a key and a phone.
That would be me, yeah. Thanks. Come on then, Fatty.
Susie? Hello.
Lily, come here, please.
Hello. No, they can do with all the help. They need all the help they can get. It's just looking at flowers. It's fine.
And did you have any other problems in the pregnancy that I should know about?
My left outer thigh went numb, went about 20 weeks, and it's still numb now. And I assumed after I gave birth, I thought, oh, it'll just go away, but it hasn't.
Which bit of it's on the outer border there?
Starts about here, goes down to about here.
Are you all right?
Yeah,
Shall we
of course.
take him over here? You can just lie him on you.
Do you think you could hold him just for a sec? So I leak really badly, and I've got these breast shells. It's a bit embarrassing, and I frequently do that as well.
Well, I'm having to practice because my first grandchild's coming soon. So
Oh, wow, congratulations
I know. So this is kind of fabulous.
Just up here,
like that. And then if you take him...
Yeah. Hello, little one.
Ooh. OK, that's great. So here's a bit of cotton wool. I'm just touching your other leg with that. Can you feel that?
Yeah. Yeah. Yeah.
And how does it feel? Is it...
It's really hard to describe because it isn't...
It's less.
Yeah, it's just less. That's the only way I can think to describe it.
Now, I'm not going to hurt you with this, but I'm just going to... It's a pinprick.
Yeah. Yeah. It's very, very slight, though.
The good thing is the sensation is actually there.
Yeah.
Let me get that back up. I'll come and help you in a second.
Thanks.
So the sensation is there. That nerve has obviously been probably bruised at some stage. I think it's a matter of waiting. The nerve is working because you can feel pinprick, you can feel different kind of sensations there. And although it's a bit dull, it will slowly, slowly come back.
That makes
Sit
sense.
tight. It will almost certainly just slowly recover.
Hi, I've run out of my pills. I don't know if I need to make an appointment with the nurse or can I just get a prescription?
Contraception.
Yeah.
A nurse appointment every time you need a prescription.
Oh, is it now? Oh, I thought it was every, like, 6 months or something.
Hello there.
All right.
Come along. So I think Dr. Pitt arranged for you to come and see me, is that right?
Yeah.
Yeah, and prior to that, you'd seen a physiotherapist who thought that it might be useful for you to have an injection. And they've written in the note that they think you've got something called trochanteric bursitis, which is a inflammation in the layers over the hip joint. Yeah. On which side is that? Is
On the left.
Left side. Yeah. Can you show me where the pain is?
I'll stand up and show you.
Yeah.
There.
Yeah, let me just have a feel down here. If I hit a sore spot,
Yes,
that's it there, is it?
Yes.
Oh, sorry. Okay. Well, that is over what we call the greater trochanter, so that would fit with this. So what Dr. Pitt suggested was that maybe we put a steroid injection into that spot. So you're happy to go ahead with that on that proviso? Okay.
Give me back my legs.
Sorry?
Give me back my legs.
Well, don't have too high a hope, really. My hope with this is that we will relieve the tenderness at that sore spot.
It's worth a try.
It's worth a try. So I'll need you to get up on the couch. What we've got here is some steroid with local anaesthetic in with it. Any problems after this injection, particularly if you feel that it's inflamed or you've got a fever, do get back in touch with us. Now, I'm going to need you to lie on your side. I'm just going to mark the point. So next thing you feel will be a slight prick as we put the needle in, OK? I'll need to put it... Is that OK? Not too sore? OK, that's done. All right?
Is it? Is it done?
Yeah, it's done.
That's incredible.
OK, stick that on there. Good, we're done. All right? Do you want a hand down? Are you OK? Sorted?
Thank you very much.
All right. But we might do it again if it does work and it wears off.
It doesn't feel like anything's different.
No, but it won't work immediately.
Oh,
Give it a bit of
OK,
time.
thank you.
Give it a bit of time. OK, then.
Chris Collins, please. Morning.
Morning, Doctor. Thank you.
Hi, have a seat.
Well, basically, the big reason I came in is for the results. Are they, for the scans? And they took me into the ring thing, that you go in.
OK.
Yeah.
Let me just have a little look. I'll just get up those results. Well, the good news is that the scan is normal, and if you get more blood in the pee in the future, then we should send you back there. But at the moment, that's all that we need to do.
Right.
So that sounds like all pretty good, doesn't it?
Yeah.
And how's your mental health at the moment? How's that all going?
Oh, not too bad. I've been moments when I sort of talk to myself a bit. Not answering myself, but...
Has that been stable in the background, or is that...
Yeah.
Yeah.
There is some times when, and I got... he comes from the Greenway Centre, and I talked to him about it, that sometimes I'll look at someone driving past when I'm on the bus and think there's someone I know, and it's just trick of the mind,
Sure.
But I think I have, at the station, actually seen a poltergeist,
Great, well, how are you?
What I've got is face ache and constant gunk at the back of my throat.
So the face ache, sinus there, sinus here.
Yeah.
You're talking about her mouth breathing.
Mouth breathing?
Yes,
okay.
because she continuously breathes from her mouth and not her nose.
I'm sick from the infection because I end up swallowing it. And the pressure behind my eyes and in my face is horrendous.
So can I feel on your face?
Yeah. And is the stuff coming out of your nose?
A little bit, and when it is, it's like thick and yellow.
Come on in, have a seat.
Right, Maddie, do you want to sit over there? Rio, you can come over here.
OK. How can I help?
So Rio suffers nosebleeds quite severely.
Yeah.
Through the weekend, he had 4. 2 were very, very bad, really struggled to stop them. I pinch it up here, it then goes down his throat.
Yeah.
And he spits it out. So I literally have to just wait for it to start congealing in his nostril. Yeah. He cries with them as well. I don't know whether or not they're hurting him.
Yeah.
Since then, he's been very lethargic, very pale. I don't know whether or not he could get anemic from it. I have no idea.
How long did they last for?
So the first one he had, that lasted maybe 2 or 3 minutes. And then a couple of hours later, about 7 or 8 minutes. That was quite a heavy one. But then the last one, the third one, which was sort of in the middle of the night, that was quite severe. It was about 10 minutes. Okay. And we're going through like
show me, Rio, show me what Mum does. Show me where Mum puts the pinching. Up the top there. OK. So you need to pinch much lower down. OK?
Ah.
So that bit there is a bit solid. You can feel it's a bit solid, yep. Whereas where it's actually bleeding from, almost certainly, is just inside. So what you need to do... Is it always that side? Yeah.
That side,
so if you had a cut on your knee, what would you do?
Why?
What would you do if you had a cut on his knee? Yes, so you go like that. So to put pressure on the nose, in that bit of the nose, you have to pinch the lowest bit, OK? But mainly it'll just make a scab, and that's what you need, is you want a scab, OK? So can I have a quick look up your nose? So if you just look up at the ceiling, very gently. And he's definitely got quite a good scab there now, OK? So the important thing is not to touch it at all, OK? It's quite common nosebleeds in the summer. Because the blood vessels get bigger anyway. Okay. What I would recommend is actually pinching for 10 minutes.
OK.
So the bleeding time should be 10 minutes or less. So by the end of 10 minutes, it should have formed a really nice scab.
Yeah.
And then it just needs to be left alone. Are you happy with that? And, you know, you're nearly at the age where you might be able to do this pinching stuff yourself, to be honest. Yeah? Rather than Mum doing it. Yeah? Nah. Is that all right?
That's great. Thank you so much.
You look very well.
Thank you very much. Getting there.
All right.
Come on then, kids.
All right, kids.
Thank you.
That's OK.
Bye.
Bye now. Bye, Rio.
Well, I know that in the past you've had problems with, you know, ideas that have been difficult to explain, haven't you? And delusions that are linked to your mental health problem.
Yeah. One stage, a car went, this is a long time ago now, car went past, and do you know Data out of the Star Trek The Next Generation, the robot? I swore I saw him in the car, which was quite funny.
The mind does play tricks on people, doesn't it?
Yeah, and I actually, honest, I do actually see them. You know, I do actually see, it's not as though I sort of, there's a blank space and I imagine something. I actually see something through my eyes, which is...
And that's what, you know, when people talk about hallucinations, that's what people, they're like. You know, they're really there for people.
Yeah.
That's a really good description. So it's certainly not, nobody's saying that it's, you're not seeing it. It's just that that's part of the mental health issue, we think. Hallucinations are part of a group of disorders called psychotic illnesses, schizophrenia being probably the most common of these. For some patients with chronic psychosis, they don't have the insight that means that they can see the hallucinations and delusions that they're suffering are not real. And this adds huge challenge, as you can appreciate, to how we can support them and treat them. Fortunately, Chris is in a good place at the moment, and his medication is controlling those symptoms, and his hallucinations are something that he recognises, and so currently he has good insight into his mental health problems and how they're affecting him. We'll carry on with you being supported by the mental health team at the Greenway Centre.
OK.
And then I'll see you probably in 2 or 3 months if everything's going well. Super job. Well, nice to see you.
OK, Doctor.
Till next time.
All right.
Bye.
Bye.
Good morning. Have you date of birth?
23rd August.
It's next week, my lovely. What date? You did it online. 12th, next Wednesday. Exactly the right time, but a week early.
Kirsty Winskill, please.
I like your doll.
Oh, thank you. Right, I'm Lizzie. I'm one of the urgent care clinicians. How can I help you?
We'll go with a throat infection. This morning my throat is bright red. My voice is gone. It's very painful.
Yeah.
I've got a friend's wedding to go to tomorrow.
Oh, no. No singing for you. Is it a church wedding?
No, manor house.
Stand at the back, I just had to mime. Right, OK. Do you think you've had a fever at all?
Hard to tell, I feel hot. But
Yeah, it's pretty hot. Yeah. Not felt freezing cold, though?
No.
No, good. Have you been taking any painkillers at all?
Not yet today.
OK. So your temperature's normal, 37.2. That's good. Let's have a look in your throat, then. Stick your tongue out for me. Nice big ah. So it's quite red. Your tonsils don't look... Yeah, your tonsils don't look too bad. Let's have a feel of your throat here. Is this sore?
There, yeah.
All over. Quick look in your ears. Have a stand up for me a second. OK, turn around. Let's have a look in this one. OK, so your ear canals are a bit red, both of them, and your eardrums look absolutely fine. So I think it's probably a viral sore throat. There's no pus on your tonsils. Your temperature's normal, which is good. With tonsillitis, there's 2 types, there's viral and bacterial. Viral is just really annoying, we can't do anything about it. It's just a case of just waiting and painkillers. I think are you off today or have you got to go to work?
In work.
So just a case of rest as much as you can tonight, early night, painkillers, paracetamol, ibuprofen with your food, and the throat spray if you want to get some of that from the pharmacy. Okay. Loads of water, and try and avoid alcohol tomorrow. But other than that, have a fabulous weekend.
Try to.
All right.
Thank you very much.
See you later. Bye.
There's a lovely handbag here. Take care.
Thanks very much.
Bye-bye. Thanks.
Tidy up for her. Tidy up.
Don't worry. I'll do
OK,
it.
thank you. Bye-bye.
Okay.
Thanks.
Bye-bye. Thank you. Tidy up.
Tidy up now.
Ratman? Yeah, OK, brilliant. Oh, I lost 4.5 pounds at Slimming World.
Well done. Don't look at the fridge now, then.
No. OK, bye-bye.